Traditional systems of medicine use whole Bacopa MONNIERI or a ghee-based emulsion, but people also take Bacopa in capsules, supplement blends or extracts. The major ingredient in the Bacopa extract are chemicals called saponins and also bacosides. Bacopa extract comes in a water-based, alcohol-based or oil-based variety. The herb contains an array of compounds that can affect your body and your brain. Each compound exerts unique effects, as well as synergistic effects when taken together in a Bacopa capsule or an extract. Bacopa MONNIERI works by changing the level of neurotransmitters like dopamine, serotonin, and acetylcholine in your brain. It also balances stress hormone levels like noradrenaline and corticosterone in animal studies. Not only can it modulate neurotransmitter levels, it can also increase cerebral blood flow and change the translation and the expression of specific receptors in the nervous system. This is how the Bacopa may improve learning and memory, sleep, relaxation, and mood. According to studies, Bacopa also affects the level and the action of brain-derived nootropic factor. Brain-derived nootropic factor is associated with increased neuroplasticity, which is the ability of your brain to change and to learn new things, and it lowers the level of depression. Brain-derived nootropic factor is also neuroprotective, meaning that it protects against injury or damage to your brain and your nervous system. Another way that Bacopa exerts neuroprotective effects is through antioxidant, anti-inflammatory, and immune-boosting mechanisms. It can enhance the function of your body's natural antioxidant defense system, reducing oxidative damage. Studies show that Bacopa reduces hydrogen peroxide levels, lipid peroxidation, and other measures of oxidative stress that are associated with cell damage and inflammation. The health benefits of Bacopa range from increased memory and reduced anxiety to better lipid levels and a reduced risk of heart disease. Numerous studies support that Bacopa has a nootropic effect in adults and children, enhancing brain health and memory. The cognitive effects of Bacopa are immense. At 320 or 640 mg doses of the Bacopa, it can improve multitasking, stress reactivity, and reduce anxiety during demanding cognitive tasks, allowing people to do multiple tasks at once. A meta-analysis of 437 healthy human subjects showed that Bacopa improved cognition and it decreased choice reaction time. In a 90-day trial, 62 participants were given 300 mg of Bacopa extract per day, and they experienced improvements in spatial memory, working memory, and rapid visual processing. A review of 5 studies found that Bacopa improves language skills in children, including vocabulary, spelling, processing sounds, and understanding words. It also increases the number of items that children can recall during a test. In a study of 300 children, Bacopa improved spatial working memory and strategy. Bacopa reduces the perception of stress and anxiety in healthy people, as well as people who are suffering from anxiety. In a double-blind trial, the herb decreased cortisol levels and perception of stress during demanding tasks. In people with anxiety and neurosis, long-term Bacopa supplementation enhanced memory and learning. Bacopa can also reduce stress-induced damage to the hippocampus, the primary area of your brain that's involved in memory formation. Studies in rats have also confirmed Bacopa's anti-stress properties. Bacopa increases the brain levels of brain-derived nootropic factor and serotonin, both of which have antidepressant effects, as well as other neurotransmitters like dopamine. In one study, Bacopa was found to help to prevent seizures in epileptic patients that were caused by an imbalance of GABA levels in the brain. In a study of 120 children newly diagnosed with attention deficit hyperactivity disorder, researchers found that a herbal preparation containing Bacopa MONNIERI improved attention, cognition, and impulse control. In another similar study, children aged 6 to 12 who were diagnosed with ADHD before the age of 7 found that Bacopa reduced the symptoms of ADHD and that the children tolerated it well. While the benefits of Bacopa for dyslexia have not been studied in clinical trials, preliminary evidence suggests that it may be helpful. A neuropharmacological review of studies of Bacopa on children found that it improved their language domain performance. Bacopa can have a wide range of anti-inflammatory actions in your body and your brain, most of which are caused by its antioxidant effects. An extract of Bacopa promotes the scavenging of free radicals, and it protects brain cells against cytotoxicity or cell toxicity and DNA damage that can lead to Alzheimer's disease. Bacopa also has a dose-dependent capacity for scavenging free radicals and preventing DNA damage in the prostate gland of aging mice, and this may translate to human prostate tissue. Bacopa can also inhibit brain inflammatory pathways by preventing the release of pro-inflammatory cytokines. Early in vitro evidence suggests that Bacopa may reduce inflammation in rheumatoid arthritis. Inflammation and cell damage appear to be major causes of Alzheimer's disease and other forms of dementia and degenerative age-related brain disease. Researchers speculate that the Bacopa could reduce the likelihood or delay the onset of neurodegenerative and other age-related diseases by reducing chronic inflammation and other effects related to the aging. According to a review of 6 different studies, Bacopa improved memory recall in people with dementia or significant cognitive impairments. Several studies have also found that Bacopa improves cognitive performance in healthy older people. In a study of 136 healthy older people, 300 milligrams of Bacopa caused significant improvements in memory retention and recall. In a study of 35 people over the age of 55, an extract of Bacopa improved their memory score, particularly logical memory and pair association. Bacopa reduced beta-amyloid plaque formation. Beta-amyloid plaque is a major factor in Alzheimer's disease. Studies of cell cultures and animal models predict that Bacopa may also be neuroprotective in Huntington's disease and Parkinson's. No large randomized controlled trials have yet demonstrated that Bacopa is effective in reducing blood pressure and preventing heart disease. However, there's limited human data that supports the possibility. In post-menopausal women, a Bacopa extract reduced LDL cholesterol, triglycerides, and blood pressure. Acting through the nitric oxide pathway, Bacopa reduces blood pressure in rats. Bacopa also protected rats' hearts against injury that was caused by ischemia and reperfusion. In rats, an alcohol-based extract of the Bacopa reduced high cholesterol levels. And another study found that Bacopa, as part of a herbal formulation, protected against heart damage in the rats. Bacopa also appears to protect against biochemical changes and heart valve issues in rats with high cholesterol. Mast cells produce and release histamine, and this is involved in your body's allergic response. Bacopa acts as a mast cell stabilizer, reducing the production of histamine. In Ayurveda, Bacopa benefits those with asthma. Rat studies have found that the herb induced bronchodilation, and it reduced exhalation pressure, validating its traditional role in supporting asthma relief. Traditional Ayurvedic use of Bacopa to enhance the function of the immune system is validated by studies examining the effects of Bacopa on the immune function. Studies of healthy cells and cancerous cells predict that Bacopa and Bacopa extracts can help to prevent cancer by preventing the replication of cancer cell lines. This can cause cell death of a cancer cell and increase antioxidant levels. In mice, oral Bacopa extracts slowed the development of solid tumours. Findings in rats predict that it may help to prevent colon cancer. Bacopa benefits also include its antimicrobial action. It inhibits Staphylococcus aureus, cholera, Heliobacter pylori, Salmonella, and E. coli, as well as antifungal activity against Candida and black mold. In systems of traditional medicine, Bacopa leaf juice is given to children to help to alleviate diarrhea. Bacopa is also used traditionally for constipation and other stomach disorders. A trial with 169 participants demonstrated a possible benefit of Bacopa in alleviating the symptoms of irritable bowel. In normal rats and rats with type 2 diabetes, Bacopa has anti-ulcer and ulcer healing effects. Bacopa enhances the mucosal defense factor in the gut, and this may explain its anti-ulcer effect. Rat studies show that Bacopa protects against acetaminophen or Tylenol-induced liver damage by increasing antioxidant levels. Bacopa may also protect against morphine-induced liver damage. In India, fresh whole Bacopa is crushed and consumed with cow's milk to help with irregular menstrual cycles. In post-menopausal women, an extract of Bacopa reduced insomnia, lowered blood pressure, and it improved cholesterol and triglyceride levels. Bacopa extracts are sold in powdered form, in capsules, and as a liquid extract. Bacopa studies commonly use 300 to 450 milligrams of the extract per day for healthy adults, but some studies have only used 20 to 100 milligrams. Children and other sensitive people should start with a lower dose. Take the Bacopa supplements 1 to 2 times per day, before a meal, with a full glass of water. Because Bacopa is fat soluble, it absorbs better if you consume some healthy fats along with it. Bacopa has few side effects and low toxicity. Even children tolerate Bacopa well in the studies. In numerous studies, people tolerated 20 to 450 milligrams of Bacopa per day with minimal side effects. The most common short-term side effect that people reported was nausea and an upset stomach. There doesn't appear to be any negative chronic effects of Bacopa use in human health. In one rat study, researchers found the upper limit was equivalent to a human dose of 25 grams of whole Bacopa leaf per day. There's very little evidence that extracts of Bacopa have caused any serious clinical, neurological, or hematological complication or damage to organs. Because it can increase serotonin levels, you should be monitored by a health professional if you're taking it in combination with SSRI or other prescription antidepressant drugs. Bacopa inhibits liver enzymes called the cytochrome enzymes, and these are involved in the metabolism of certain drugs, so again, you should check with a doctor before using Bacopa if you're taking any medication. A study of Bacopa with amitriptyline, a tricyclic antidepressant, showed that the Bacopa could increase the level of this drug. For more information about herbs, supplements, or natural treatments, check out my website.